All right, Dan, thank you very much. You know, for most guys, losing our hair is tough to take. That's why Frank Marzullo is in on this interview. There's a revolutionary new procedure that may help.
It may help. In fact, I'm undergoing that procedure, which uses lasers, Rob.
That's right.
A lot of lasers, too.
Joining me this morning, Dr. Jon Mendelsohn, and of course, Mark Lucas with Advanced Cosmetic Surgery and Laser Center right there off of Edwards Road.
Good morning, guys.
Good morning.
Good morning.
Now, first of all, let's talk about Frank's perceived problems in terms of hair loss. What is the problem?
Well, Frank typically has male pattern baldness, and with male pattern baldness, every time that we lose a hair, the one that grows back is finer and weaker than the one that fell out. When we look at the scalp, we can examine and determine which hairs are miniaturized, which hairs are not. We have the scope here that identifies what we're looking at.
Well, and Mark, the thing here, and if we can take a look at the scope here, and I want you to do this at the top here, what are you looking for? Because this new procedure we're going to show you in a second does not necessarily grow hair where there's no hair. You need hairs down there, correct?
You need miniaturized hairs. This is not for someone. This is not for someone that doesn't have any hair whatsoever.
So Mr. Clean's not going to come in here, and you're going to put it on, and it's going to grow him a big head of hair.
Absolutely.
That's where hair transplants would come in.
Yeah, but Dr. Mendelsohn, it is groundbreaking in that it's helping more people, and especially helping women, and it's portable.
Yeah,
tell me about all the benefits.
Yeah, that's correct. So the capillus 272 has 272 diodes in here, stronger than the laser where patients used to come in for 35 treatments throughout the year. So this is portable. You can place this in any ball cap or cap. Women, the nature of their hair loss is different. They typically are thinning. They don't lose those hair follicles. And so these miniaturized hairs that we see will grow back with laser treatments.
When you use the word diodes, what do you mean by diodes? Are these just like LED light bulbs? What is that?
They are lasers at a specific wavelength that are targeting. What they're doing is they're stimulating the hair follicles, the blood vessels in our scalp to grow, to nourish the follicle that is receding.
Well, I'll tell you what, a lot of people are skeptical. They're watching this morning, they're like, when lights in a hat, give me a break. But not only do you specialize in hair replacement for 20 years, you're also a client, correct?
I'm also a client.
How did it work for you?
You know, I've done a lot of different things over the years. I've had hair transplantation, I've done lasers. Recently, we've developed non-surgical grafts, so I've done a little bit of everything.
And you were telling me you were a little skeptical about this at first.
Skeptical.
But when you saw, and you only had, what, 40 bulbs on the in-office unit? This has 200.
So it's more powerful.
More powerful.
Absolutely.
I'm doing it about 3 times a week. Is that pretty much the average, about 30 minutes? And how long until you start to see results?
That is the prescription. These can only be bought through a doctor's office. 3 times a week, 30 minutes each. And typically at about 4 months, you start seeing a change. And a lot of times your hairstylist sees the change before you do. Your hair will grow quicker.
It's very portable. I mean, you can put a Reds ball cap over this and just walk around, keep it in the car, nobody would know anything.
I got a question for Dr. Mendelsohn. I mean, you do so much in terms of transforming people. What is it with guys in our hair? What is it about guys in our hair and losing our hair?
You know, I've got to tell you, it's not just guys. I know you're asking guys, but women really are devastated with hair thinning and hair loss as well. You know, it's a lot of self-confidence. It's anything else that we do, whether or not it's a mole or a line or hair loss.
Because really, honestly, I mean, it's not about how you look, it's about how you feel.
Absolutely.
And how you look has a lot to do with how you feel, right?
Well, depending on what you do and if you're out there.
Okay, so now what's next for Frank Marzullo here?
As we're looking at the video right there, too, I mean, when we did the consultation, we're trying to get hair in the front, right?
Absolutely.
Have you noticed a difference yet?
No, it's only been about 4 weeks.
About 4 weeks.
So it's going to take a little time.
So seeing as though Frank is here, the capillus will help with some of those hairs that are miniaturized. Frank has lost some hair and lost some hair follicles where traditional hair transplantation, microfollicular grafts might be helpful. Additionally, if Frank were so inclined on his crown here, seeing as though he's volunteering, he might be a candidate for these advanced non-surgical hair.
Well, I'll tell you what we're going to do is we're going to keep following Frank's progress right here on the Fox 19 Morning News.